Healthcare is now much more focused on everything being done through electronic means. I suspect that that's every business today. And I think back 30 years ago when I started and how much of healthcare was done on paper, going into medical records and seeing the huge stack of papers slotted sideways. We really didn't need to worry about IT outside of this very basic functionality. We were small enough that having one person doing that function was more than enough. But now, here we are 30 years later, and everything's electronic. Our system grinds to a halt if everything isn't working smoothly. And so it's the healthcare component for the patients that we serve, their ability to communicate to us through phones, which are now an IT structure, their ability to get into the patient portal to request some information from us, their ability to get a copy of their records and have it be secure and not worry about a potential breach. So much of what we do involves really sensitive information. It's a bad idea to not really be well protected. So having a firm like a Mainstay that's got that depth and can cover so many areas for us is super important. It's really, it's impossible when you think about the number of breach notifications each of us gets at home for JCPenney or for Target or for, huge corporations that probably invest millions of dollars that we as a little tiny organization with 215 staff can have a high enough level security that we aren't having breaches says a great deal. I think what I have been surprised about, I was nervous when we outsourced services because we had a team of 4 that was here on site. They were known commodities, people got to see them regularly, but they were struggling. They were really struggling to keep up with tickets. They were struggling to keep up with technology. They couldn't have had enough depth and expertise to bring forward solutions in so many areas that we needed. And so what was happening was stuff was just getting stuck in pipelines and staff were getting frustrated. So when I think about the people first approach, I think about the people that we deal with on a regular basis from the team and how quickly people respond, how easy it is to stay in touch, how easy it is to set up a meeting with the team and bring somebody in and say, can you help us take a look at this? We're a little flummoxed. And given the amount of changes that we've made in just the 18 months since we went live with the contract, I'm amazed. And the fact that there's a team of several specialists and subspecialists within the Mainstay rubric, it gives them the ability to tap in as needed to all of these resources. And that's where we were coming up short trying to manage this in-house. And the people are amazingly kind. They're high EQ. To be honest, there's a lot of our IT staff historically that have not had the best people skills. And I like people, and I like people who have people skills. And I've learned over the years, they're IT, they're just kind of tough to deal with. And I don't have that experience at Mainstay. They have the best people skills of any IT team I have ever met. And I don't know if there's some special sauce in the interview process where somehow high EQ is an equal measure that in the skill sets that you're recruiting onto the team at Mainstay. But my experience has been they have excellent people skills and our staff greatly appreciate that. So it's been a pleasure since engaging with the team at Mainstay has been their ability to ask questions we don't know to ask. So taking my non-IT brain and then somehow figuring out where I'd like the organization to go, but giving me guideposts to say, but here's key decision points you're gonna need to make. Here's the pros and the cons to this option versus this option. Here's the cost differential between going left or going right, or maybe there are 3 options. But framing it in such a way that I have enough data that I can make decisions even though I am not an IT person, and engaging the management team and others on our team to understand limitations, security impacts, functionality impacts, something that will slow down the system. So I think they do a really nice job. And if you need to frame something and give them kind of guidelines to say, we have to stay within this set of criteria, can you help me find something that would be a fit for this expectation? Maybe it's a HIPAA expectation, maybe it's a expectation from one of our funders, maybe it's some other new feature that we need to add in. They will then go out and research and circle back to you with ideas, with suggestions, and kind of give you again, here, you could do this, you could do this, or you could do this. And they give you price impact, long-term impact, short-term impact, and then pros and cons to technology and features. And I think that's super helpful for the leaders in the organization. And they're willing to train. Like Beth Ann has become an internal SharePoint expert, but knows she can pick up the phone and call and say, this part isn't working for me, or I need it to do this. And that's a great thing that there's somebody inside that we can reach out to and ask those critical questions. So I've done a few references actually for Mainstay because of exactly this challenge of having another person be in the position we were in a couple of years ago when we were thinking about this very tough decision and whether we wanted to outsource services, whether it would be good for the organization, and the fears that come along with letting go of kind of control. And I've had a couple of really positive conversations with people that are in a similar boat, thinking through the same things we were thinking through at the time, asking some of the same questions we were asking at the time. And what I can say is, I didn't appreciate that 4 people cannot replicate the knowledge base and expertise level that you can get in a group of 100 to 150 people that can subspecialize, can really bring totally different skill set that can complement one another. And that, for many of us that are smaller organizations, in New Hampshire is largely majority small business. That is our bread and butter in New Hampshire, small companies. And there are a few really amazingly large health systems as an example, but they are the exception. They're hospitals, right? So for most of us, we're small shops trying to replicate inside this incredible infrastructure that we could never manage to replicate, no matter how nice our own staff are, how dedicated they are. 4 people cannot bring that level of expertise and knowledge. So that's where the comfort level comes in. Once you get in, you recognize that your client manager will tell you, that's not my area of expertise, but I know who we're going to speak to. Let's connect you with Connor, who's going to talk about this security issue. Let's bring in a conversation with so-and-so who's looking at AI for our organization. And there are all these people. I've probably worked with 15 different people at Mainstay around totally different issues because they have those people. We didn't. And anytime we had something our internal people couldn't manage, then we had to pay to outsource. And the rate we were paying for that outsourcing was really expensive because it was then consulting level. This is built into your contract at Mainstay. The internal consultation is available because they're part of the depth of the team. So I think in the end, even though it's a scary jump to make, it's a great jump to make.